Huh? Ladies and gentlemen, welcome everyone to this webinar on taking care of our senior citizens. The coronavirus, COVID-19, has caused a worldwide pandemic that has changed how we live. These are very challenging times, extremely demanding times for all of us, and even more so for older individuals with multiple chronic conditions, as they are at a higher risk infection from COVID-19. As per available statistics, the mortality rate from COVID-19 in India is more than 75% amongst older age group, that is 60 years and above. And therefore, we need to take full care of them. Our Prime Minister, in his latest address to the nation, mentioned about taking care of elderly as the foremost sutra to be followed by all of us. So to take this discussion forward, we have a very, very distinguished panel with us today. Before I introduce them, I request our online viewers to leave their questions or comments in the chat box. We will address them one by one. I welcome Dr. Vinod Paul, Member Health and Nutrition Niti Aayog. He's a very, very distinguished doctor, academician, nutritionist, and a public health specialist. We have with us Dr. Day, who's professor and HOD of the Geriatric Department in the All India Institute of Medical Sciences. We have Rujuta Divakar, who's a distinguished nutritionist from Mumbai. And we have with us Dr. H.P.S. Sachdev, the senior epidemiologist, Sitaram Bhartiya Hospital and Medical Research Center. We are extremely grateful to all our panelists who have joined us today. We look forward to their very, very distinguished views. I first request Dr. Paul to provide us insights to all our viewers on why do we need special focus on elderly during COVID-19, Dr. Paul? Why are you laying stress on the elderly?
Thank you very much, Amitabhji. The elderly of our society are very special individuals, very special citizens. They have contributed to the nation, and now they are living a phase in life which is challenging in terms of prediction for illness. As you grow old, the body systems tend to become weak as a part of aging. So old people were always special to us, and we need to take all measures to keep health and nutrition and well-being of our old elderly in good shape as a part of our overall endeavor for health and welfare. But the times of COVID have brought this aspect into a very sharp focus. We know that this virus is very contagious. It actually does not respect anybody. For some reason, we think children are protected. We're still learning why, but it is contagious. And all of us above the age of 15 in particular are equally susceptible to be infected by the COVID-19 disease. And it does not spare the old people, particularly old people which are still active in their social and family life. But what is very critical, and that's why we are here together, is that although susceptibility at all ages may be same in adulthood and beyond, but the severity of illness, the morbidity associated with the illness, and above all mortality associated with COVID-19 is clearly highest in the elderly. And as the age advances, there is a linear relationship with serious disease and adverse outcomes. This is something which comes from the studies that are available to us, experience in other countries, but also the emerging experience in our own country. Small case series from Mumbai from Ahmedabad, you name it. There is a clear message that we need to look after our old people. We make sure that they are protected from getting COVID, and we'll talk about how that can be and should be done. We should make sure that their nutrition and is looked after well, their immunities are the best possible. We'll talk about that. But then above all, it's very important for us to recognize the fact that if they become sick, they need to be picked up, identified early, because early detection could pave way for a better outcome. So we are concerned about the unusually excess predilection of our elderly for adverse outcomes of COVID-19. And therefore, all efforts should be made to cocoon them, to protect them, to engage them in such a way that they protect themselves. And there is a very important aspect, Amitabhji, and that is that when you create social distance with the elderly, then there are aspects of psychological stress, and we wish to discuss that.
Thank you. Thank you, Dr. Paul, for your insights. We greatly appreciate this. I would now like to turn to Dr. Day, and I would like your view, Dr. Day, on what are the possible ways to take better care in the present circumstances, and what are your insights on how best we can take care of our elderly population?
Mr. Amitabhji, and thanks, Dr. Paul, for having me here. And that older people, though we make a cutoff of 60, but as the age advances, they are not in the best of their health. So obviously, any issue that affect their overall health can extent that we see they don't do very well with the infection, even with plain and simple pneumonia that younger people will come out. Older people have got higher case. In that scenario, COVID, in that scenario, greater impact to their health. And on an average, an older person has got about 3 illnesses as a result of the lifetime exposure to various risk factors and environmental hazard, lifestyle, nutrition, etc. So as a result, they are predisposed to poor outcome of any illness, excess disease or communicable disease. So obviously they are at a higher risk. So in that scenario, that we recognize that people are at a higher risk. It is important that we in the health system and the social welfare system make a they are well in this case. Many ways of doing it. Well, the social advice regarding preventing infection remains same. The other issues also are important. I'll stop at that and wait for your next question.
Thank you. Thank you, Dr. Day.
Yes.
I would now turn to Rujita Deveka, who's a very, very distinguished nutritionist. She works in Bombay. I would request her to share her views on the importance of nutrition in elderly to fight against COVID.
Thank you very much for having me on this very distinguished panel, and it gives me great pleasure to be here. It's a true honor, and also in many ways it's like giving it, in some ways saying thank you to the elderly, because my entire career is built on the advice of grandmothers. While I think nutrition sciences are still learning how to learn better about food systems and go beyond carbohydrate, proteins, and fat, I think our grandmothers already had advice which was connected to culture, crop cycle, and climate. So in our collective wisdom, our grandmothers already knew about the benefits of haldi or avla, or for that matter, even neem, long before fashion magazines and cool cafes discovered it. So what can we specifically do for the elderly at this time? I think given all the comorbidities that they are facing, I have like 5 superfoods which belong to, which are native to India, which they will find in their kitchens right now, because we really have this huge diversity of making nutritious dishes out of so many non-perishables like millets and dals and pulses. And here's my list then. So the first thing that I would ask everyone is to start their day with a handful of nuts, especially the elderly, because it also helps them with their mental health. It helps them with joint health, and it is obviously very good for the heart too. For all those who are unable to chew them, you could powder them and then have them, or have it with a cup of milk. Ragi is another millet which is extremely important, ragi or the finger millet or nachni, because it's rich in iron, it's rich in calcium. While you are in the whole lockdown phase and your activity comes down, there is also constipation, and ragi will help with digestion issues also. So ragi is critical. You can turn it into a porridge, a paratha, a dosa. You can make it in multiple ways. So ragi for either breakfast or lunch. The third thing that's important for the elderly to eat is a fresh fruit. So depending on the region that they belong to, either the melons which are in season right now, the banana, or even the mango, for those of you who have access to it. And because there isn't a better source of antioxidants than a fresh fruit. It is also cooling in nature, and we have heat right now, so that would be a good option. The fourth thing would be dal khichdi for dinner. We all know now, I think the weight loss industry knows now, that superfood is not some smoothie, it's khichdi. And khichdi with ghee, good to sleep well, easy to digest. Just one request to all the people who are watching: don't eat your dinner to the TV. Finish eating your dinner and then you can watch TV or be on WhatsApp. And lastly, a cup of haldi and milk at bedtime, especially for all those elderly who are suffering from poor sleep, especially during lockdown, or who are needing to wake up often to go and use the loo. So milk has a good hydration index, and haldi is anti-inflammatory in nature. So you can have haldi milk in the night and end your day. That is something that I would aspire for all our elderly people to eat. It's easy, it's accessible, it's inexpensive.
Wonderful, wonderful. So I'll repeat that. You are saying a handful of nuts. You can also powder them and put them in the milk. Ragi millet with porridge or paratha. Fresh fruits, banana, mangoes, and anything which is a fruit in your region.
Yes. Mm-hmm.
And you're saying the superfood is dal khichdi with ghee. And you're saying that's good for health. That's really good for health. A little bit of ghee.
Yes.
And haldi and milk before sleeping.
Yes. With
Wonderful,
a little nutmeg,
wonderful. That's
people have sleep problems. Thank you, sir.
Thank you. Really good. Outstanding advice. Grateful to you for this. Dr. Sachdev, I want you to give us your insight on sound mental health for elderly during COVID times. What would be your advice?
So I think we should all first realize that in all our religions and scriptures for age-old Indian time, the importance of mental and spiritual health has been recognized, and that is what has given us strength to pursue over such a long time. Why is it important to look for the psychosocial and the mental health issues during this period is that even though the effects may be small, but the almost all the individuals or a large part of individuals in this unprecedented situation are likely to experience anxiety and stress, and this is going to make the elderly quite more vulnerable. So this could have a very huge indirect effect on the health, particularly of the elderly, because it goes into the inflammation and the other factors. So I would say that there are 5 principles which would perhaps apply to all individuals, and we need to tailor it or make it specific, situation specific for all of them, including the elderly. So the first one I am saying is the important message of social distancing, which is being made, is being slightly misinterpreted. What it actually refers to is physical distancing while having social connection or cohesiveness. One can remain socially connected, and it's very important for all individuals to remain socially connected, but at a physical distance. This could be done through voices, the telephones, and so on and so forth. If you become socially isolated, this is going to fuel your stress and is going to cause a lot of more problems. So do not practice social isolation, rather have social cohesiveness is the first message that I would like to give in whatever way is feasible under whatever circumstances. Second, you have the age-old saying of use it or lose it. So you need to exercise your mind as well as the body together, because both of them will lead to a sound mental health and relieve the anxiety. So exercising the mind, one can go ahead and do this in whatever way the elderly are more practiced or more tuned to look at meditation or spiritual experience. They should keep some time aside for that, and they should be engaged in their games or whatever exercises the brain, depending upon their intellectual level or whatever they are comfortable with, playing chess, ludo, or whatever it is in the house. Physical activity is a very crucial part of relieving the anxiety or the stress. People are confined there, or they would have courtyards to walk about. So our traditional method of yoga to relieve the physical exercise or stress is very important. And in addition, some balancing exercises and walking to the extent that is possible is necessary. Otherwise, one will be physically incapacitated to some extent, which will fuel the anxiety or the stress. Third point is you should try to create a new routine for your new normal as it is, or whatever way that you are living in, so that you have something to look forward and a time clock sort of to set and do that. And important in that is to set the time for the meditation or the physical activity. And if you are actively engaged senior citizens, I see there are at least 4 of us senior citizens in this webinar, we can take to some activities to address or help the community in these times, or do it as a peer group. It will not only give us satisfaction and benefit, but also to the others. So keep yourself engaged. In the daily routine, it's very important to take adequate rest for the seniors. And of course, you must have adequate quantity of the sleep. And the fourth are some don'ts which are important to do that, which would fuel anxiety or precipitate the anxiety and the stress levels. And one is to be totally glued to the television or whatever source of news you have, or what has been also referred to as an infodemic, and you go on, it is going to fuel your anxiety. If you want news about this epidemic, go to a specific place, one which is reliable, maybe once or twice in a day, and don't go about looking at unverified news and so on and so forth. In your anxiety, many people may like to take alcohols, drugs, or other smoking substances. They are a strict no-no because they will fuel your anxiety and create. Finally, I think the caregivers or the family has to come in to take care of the social cohesiveness, get in touch with them in whatever way it is, make them feel reassured, not old and useless, and they should be told to seek help in whatever manner they can when they feel very uncomfortable. It could be from the family, or the government of India has set up websites for managed psychosocial stress. This could be done. And finally, some telemedicine from the counselors could be available. Thank you so much.
Thank you. Thank you so much, Dr. Sachdev. Greatly appreciate this. Dr. Day, I want to turn to you again, and I want to ask you, what are the do's and don'ts to be kept in mind for reducing the transmission of the virus amongst the aged population? Sorry, before we get on to Dr. Day, I would like to turn to Dr. Paul and seek his advice. On really, Dr. Saab, how do you ensure that we are able to reduce the transmission of the virus amongst the aged population? What do we, the younger lot of people, how do they ensure? What are the do's and don'ts they need to follow?
Well, firstly, on the part of the elderly, They should maintain social distance. They should not meet people to the extent possible. And during lockdown stage in particular, there are more rigorous protections to be taken and social distancing to be ensured. I think Dr. Day can throw more light on this, but let me respond to the main question that you asked. What is our responsibility, the responsibility of other members of the family when we have an elderly in our family or around us in the workplace? Well, then I think we fall back to the same golden principles. One, that we wear masks. We wear masks, particularly it should be a way of life in any case as a new normal, but particularly when there are elderly in the room, in the house, the elderly should also wear the mask. We should, if we have to converse, we should stay at a distance of about 2 meters, definitely more than 1 meter, and we should ensure that we have the coughing etiquettes taken care of, that we use Koni to make sure that the cough is not spread. And we also make sure that we are at the same time responsible for ensuring the emotional contact, which Dr. Sachdev talked about. Social distancing is not emotional distancing. So the times when interaction is possible, maintaining the social distancing must be kept aside. Time should be spent with the elderly. There are carving out fixed possibilities in a middle class family of a certain time when everybody is together and yet there is a distance being maintained. These are very, very critical elements for us to follow to protect our elderly.
Thank you. Thank you, Doctor. I wanted to turn to Rujuta Divakar because she gave some very interesting inputs. You are a great nutritionist. Can you share us some views on how elderly people, in addition to the nutritional diet, the great nutritional input that you have recommended, how can we make them stay active even while staying at home? Because Dr. Sachdev talked about not social isolation, but keeping them socially busy and socially active. How do we keep them active even while staying at home?
Yeah, it's a good point, because I think that is something that they have also been missing, because this is our morning walkers group, largely. So after Honorable PM's last address, where he said that it is the elderly that need to be looked after, what I did was I released a 5-part series of exercises that the elderly could do at home within the safe environment at home, which they could do either on their bed or on the chair or on a mat. And I think doing a few stretches every day, or like the way Dr. Sachdev mentioned, maybe playing Ludo, meditation, playing chess, maybe playing cards, all of those could be extremely engaging ways of staying active and healthy. But I would also have one more request for all of the elderly. I feel this lockdown is allowing us to break the chain of the virus. But until the lockdown happened, what was happening is that there was our unbroken chain of food wisdom was under the threat of being broken down, because there was almost no chance of documenting it and passing it down to generations, as the weight loss fads do. I think this will also be a good time for the elderly to actually jot down all of the recipes that they would envision their next 7 generations to be eating. So even if it is just making something like dal khichdi, I think a lot of us in the younger generation struggle with exactly how much dal for the rice that we are using. So if the elderly are able to use this time to document recipes, even something as simple as dahi kaise lagana chahiye, if they are able to document that, it's a good way of staying engaged. They can take pictures, they can write notes. They're also, most of them are very good at filing and documenting. And I think that would be a great gift for the rest of the family members at the end of the lockdown. I think this is a huge opportunity for India in general to revive its age-old wisdom of cuisine, cooking, and their culture.
Thank you. Thank you. Thank you. Your insights are very, very positive, I must say. Dr. Sachdev, I wanted to ask you because due to very limited social contact during this phase, many elderly may face symptoms like anxiety, depression, loneliness. How do we address these challenges in the present scenario?
So, as I said earlier, the key to it is to make them feel productive and engaged socially with us. So that could be with the family while exercising their body as well as the mind, and all ingredients are important. Of course, a small minority of them might already be in drugs, which they will have to take as far as the advice. So you can keep them engaged in the ones who are better educated and who may be living alone with their progeny having migrated abroad. They can keep in touch with the social media as WhatsApp or whatever it is available to keep chatting with them. They could talk to their neighbors around them, but maintaining the physical distance, as Paul said. And then you have to think positive, be positive. You could tell them about the positive experiences, the caregivers who are that, yes, it is a difficult time, it could be tragic, but there are success stories and they could contribute to the success. So make them create a goal in their life so that they don't have that feeling of vacuum or restlessness. And there are scientific trials big enough through the world even before this happened that physical activity reduces anxiety, restlessness, and contributes to mental well-being. Taking care, recourse to meditation, spiritual values, you have got to do it. So I would like to say that there is no one size fits all for here. Everyone has to tailor according to the principles that I mentioned, and that is what is likely to work. And all of them going into a positive direction in their own peer group will definitely lower the anxiety. We don't need to take recourse to drugs. Thank you.
Okay. Thank you. Thank you. We are getting a lot of very interesting questions from our audience. And, we are, Sayali Tagre has asked a question to Rujita Divakar. Can I give Nachni Ambil or Hind Chas for dinner to my grandfather for easy digestion during the lockdown period?
Yes, absolutely. The amber would be very, very good for your grandfather. And if he likes his chas in the night, you could give it to him in the night. Otherwise, you can give it to him post lunch. That way he can also have, then he can have the chas
Good.
at lunch and the amber for dinner.
Chas for lunch and Ambul for dinner. Okay, good. Good. Thank you. Thank you. Dr. Paul, there's a question from Varun Miglani, and he's asking us, what are the do's and don'ts for caregivers?
Well, caregivers are coming in contact with the elderly, and therefore they could be the vehicle for transmission of the virus and making the risk for the elderly more in general. So they should practice the principles that I enunciated in the last segment, namely wear mask, wash your hands, make sure that you follow the cough etiquette, and maintain the distance, the physical distance away from the elderly to the extent that is possible when exactly care is not being given next to the elderly for very personal needs. But at the same time, very important additional aspect that I like to point out, sir, is that if they have cough, if they have fever, they should simply be away and declare this and say that I would not like to be close to an elderly of your own family or the family where you are serving as a caregiver. So a self-distance to the extent of self-quarantine away from the elderly would be a responsibility of the caregiver at this particular point in time. I would add that to my list.
Thank you. Thank you. We have many more questions coming. One from Tehammul Hussain to Dr. Sachdev. And he's asking what kinds of mental strain are elderly persons going through currently and how we can handle these with special interventions. There's also a question from Shrikant Kalaska, and he asks how to take care of elderly with chronic diseases living in rural areas in this present situation. Dr. Sachdev, would you like to respond to both these questions?
So the first question, the commonest in this situation that one is likely to have is the feeling of anxiety and a mild depression in this stressful condition, which could give rise to physical symptoms like palpitations, restlessness, sweating, and all. Some of the elderly might already be experiencing severe depression due to disease or something. They are on drugs which would need counseling. That's a separate category which I would say that one would need a psychosocial counseling or a consultation with the psychiatrist to the telemedicine. For the other ones, we have to use the non-medical, non-therapeutic or medical features like all the 5 principles that I had enunciated earlier. So the part is to make them feel productive and useful and keep them socially engaged and with embedded with positive thoughts rather than in the negative ones. And together we can do. Now some who are 80s or the 90s may not be able to do that. Try to maintain as close to a normal or a near normal routine as it is, but don't take recourse to drugs on your own like anxiolytics, which you might have available with you to give, or antidepressants. They could prove dangerous. Point number one. The second one, I think, relates to people with chronic disorders in the rural areas, which I think would be more in the domain of Professor Day. And if he would like to answer that, Professor A.B. Day.
Yeah, thank you. Thank you. I would like to, thanks a lot. There was a question for Rujita Devaka, and that is that nutrition plays an important role improving the immunity against COVID. Uh, People in rural areas, especially in rural areas, they have a lot of regional diets. Is there some special thing you'd like to advise people in far-flung areas, different regions, rural areas, on how to improve their immunity, not just for the people in urban areas, but in rural areas?
Well, I think one of the things that people in rural areas can do, which can immediately improve and work on their immunity, are all of the forest fruits that are available right now, which are often categorized as NUS, neglected and underutilized species. So whether there is karwan, or there are many of these summer berries which they grow almost as like creepers during this season, and most of them are rich sources of not just vitamin C and carotenes and likes, but of many antioxidants. So I think what rural population should do is that they must ensure that they are eating those right now, because for once, I think we have the opportunity to completely utilize them for our health. And also, given the whole lockdown situation, it's not going to be as easy to bring them to the urban markets as earlier. So the local vegetables and the local fruits is what they should rely on. And with that, they must also ensure that they are not giving up on their local millets, or cooking their rice with a little bit of dal, because sometimes they just land up eating only rice. So if they're doing that, then they must ensure that there is some dal to eat with that rice, or there's an addition of a millet.
Sure. But there are two more important questions for you. One is from Mona Punjabi, and she asks, my mom is a diabetic, so which food item should be good for her? Please throw some light. And there's another question from Aviral Sharma, and he's asking, please suggest immunity boosting measures for children.
Right.
Two very important questions.
Absolutely. I think all the foods that I spoke about earlier, whether it is nuts or ragi or nachni, whether it's fresh fruits or khichdi or haldi and milk, these are safe for your mother, Mona Punjabi. She can have that. And what she must avoid is eating biscuits or anything that comes out of a packet. So largely, I think, if we just adopt a policy which is anything that is farm fresh is fine, anything that is packet say is not fine. So if you're able to tell that to your mom, send across that message, I think she will know what all she can eat. Something, like for an afternoon snack and stuff, she can even just have a roti with some sabzi or roti with a homemade chutney. Those are all good options for your mom. For children and immunity, playing, keeping them physically engaged is important. This is also a good time for families to come together and exercise. And in the new routine that one makes, I think one must make sure that there is at least half an hour where the whole family can exercise together, because that is something which keeps up, which allows for good mood and good immunity in children. With that, there is also Chavan Prash. So if you have access to Avla or Avla Sharbat or Chavan Prash, make sure that your kid is having a good dose of that. Keep them away from packaged produce, keep them away from cereals and chocolates and stuff which are addictive in nature. Ask them to sit in one place and eat all of their meals, keep them well hydrated and no colas. So I think if we just keep up with those basics, we can protect the immunity of our children. In fact, Amitabh ji, I think I was reading one of your tweets and you said that you had no idea that you will get so many days at home where you can sit down and eat your breakfast, lunch and dinner, and you're actually losing weight doing that. So I think that's what you should be telling the audience right now, how it's helping you.
Okay, thank you. Thank you so much. Your insights are really wonderful. And I think our audience will greatly benefit from your insights. I would like to turn to Dr. Paul and request him seek his advice on what is your advice on Ayurveda, homeopathy, how these alternative medicines, how can we utilize them?
I think very importantly, there is a distinct reason that some of the time-tested products of particularly Ayurveda should be consumed by all, but even more so by our elderly. And here is the quick list that's being recommended by the Ministry of Ayush, and I'm happy to state the following. One is Chyawanprash. Good quality Chyawanprash, 1 spoon twice a day, is very useful for all. It has many health promoting and disease preventing elements, as we know. Haldi, Rujuta, you have emphasized more than one, so that is also endorsed by the Ministry of Ayush. Then endorsement for Tulsi related products, Dalchini, Kali Mirch, Sukhi Adrak, which is Sunthi. So I repeat these: Tulsi, Dalchini, Kali Mirch, and Sukhi Adrak are very useful. Amitabh ji, I'm also getting inputs from the research side on Ayurveda products, and an interesting product, Ashwagandha, is being stated by the researchers to be having elements that could protect us. So those who have been prescribed Ashwagandha, be liberal about it. But the general list is Chyawanprash, Tulsi, Dalchini, Kali Mirch, Sukhi Adrak, and Haldi. This consumption, using them in good consumption, will harm nobody. And we will strongly like to recommend and reassert the recommendation of the Ministry of Ayush, which we believe is very useful at this particular time. And also I may add that this is also a time to emphasize yoga as a health promoting and activity promoting activity. So yoga should be listed as one of the activities that the elderly and all of us can take. Thank you.
Thank you. There are a lot of questions for Dr. Day. one from Rahul, and he's asking, is it fine to take painkillers for elderly for knee pain in this situation? And there's another question which is seeking his advice on how to deal with chronic diseases of people living in rural areas in this situation. Can I turn to Dr. Day?
Yeah, I can.
Yeah, please, Dr. Day.
What we advise is, what we advise.
Yeah, please go ahead. What is your advice to patients with knee pain? Can they take painkillers?
In COVID, to continue inhalation or steroid for their asthma, everything has to remain the same. Treatment,
Okay.
all the treatment will remain same, but additional precautions of if somebody is taking an inhaler, it is better.
Okay. 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 Not getting it.
So whether rural or urban,
Unfortunately.
our personal treatment has to continue. Nothing has to be changed in this scenario.
Okay. Thank you, Dr. Day. And what about any advice for people living in rural areas? Any advice for people in rural areas, Dr. Day?
Keep in touch with the near.
Okay. 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 Unfortunately, we have a bad connection with Dr. Day. But I would like to uh, ask the last question, and that is that in the present circumstances, what would be your best advice for our elderly people? How best they can remain cheerful, in good health, and what more can we do for them? Dr. Paul.
Keep in touch on phone with your friends. Take precautions yourself, like wearing a mask, your own responsibility to ensure social distancing, but interact with the family. Devote time for yoga and your own spiritual development and meditation, and take Ayurveda product in addition to take all your medications. Dr. Dev made a very important point. He says that in COVID times, you must not forget to take your medicines, whether you are taking it for glaucoma or for hypertension. Yes, please don't forget looking after other conditions, because those conditions also create complication. And above all, very good food and diet and balanced intake of all nutrients and food products is very, very important.
Yeah. Dr. Day, what's your advice? How do we keep our elderly cheerful? Okay. Rujita, there's one question which I'd like you to respond, and which says that is Chavan good for diabetics currently, and also your last advice.
Well, I think Chavan is something which even the Ayush Ministry has asked people to take, and in the original formulation there isn't anything which is contraindicatory to people with diabetes. And if people
I
are
asked
worried
you
about
again. I asked you again because there were two specific questions. One from Bonita S to you, especially asking you for your input on this. And there's another question from coming in from Preeti Chaudhary, who's also asking whether please ask Rijita ma'am, can we use Chavan in summer?
if it is mixed with some milk, then yes. So if you're eating it and having it a little bit and you mixing it with milk, then you can have it in summer. And if you're worried about the heat, I think have it in the night when it's much cooler.
Well, there's also sugar-free Chyawanprash, I believe. I just checked. So
Okay.
those who have diabetes can vouch, can look for sugar-free Chyawanprash so that
Okay.
the positive elements are helping you
Okay.
to take them.
Okay. Thank you. Thank you. Anything else, Rujita?
Well, I think about how can the elderly stay cheerful. I think they're finding, we must give them credit for that. They're finding many creative ways of staying cheerful. I know of families having Zoom prayer meetings at 9 p.m. in the night. I know of grandchildren doing FaceTime with their grandkids, grandparents and grandkids doing FaceTime. I know of a dadi who taught her grandson how to make atta for ajwain paratha. I know of a dada teaching his granddaughter how to read Hindi. Of like families coming together for storytelling sessions with the elderly. I think that's a fun way of staying engaged, staying connected and cheerful with the entire family.
Thank you. Dr. Sachdev, I'll conclude with you. What's your advice? What's your guidance? How do we keep our elderly cheerful and lively and peppy?
One useful definition of health which would apply to seniors is a state of physical, mental, social, and spiritual well-being, and not merely the absence of disease and infirmity. So we should try to take care of all these aspects, and the physical one, which would also be important from the perspective of immunity, is, as mentioned by Dr. Dey, that whatever disease they were being treated, for example, unless the diabetes is in good control, the immunity, take whatever you want, is going to go haywire. So keep your disease under control with whatever you were doing earlier. And physical activity. Physical activity has been shown by science to improve the immunity perhaps as much or a better extent to that from the foods, and will keep you cheerful. And the third aspect, which our forefathers knew much more, Professor Paul mentioned yoga. It's a meditation and the spiritual health, which has also been shown to boost immunity and keep you healthy. And socially connected and very well connected to the extent that you could be. Positive storytelling, and for people like us who by definition are senior citizens, keep engaged, try to help this society and keep on working. This will certainly keep you on board. You can create your peer review groups. You will not only help the society, but will have an internal satisfaction. All is not lost. And finally, the positive stories. Yes, the mortality is high, but even if you get it, there is treatment available, and it's not as if a death sentence is passed, you're not going to be 100% on death. Yes, we will prevent, we'll have social distances. So keep optimistic. This time too shall pass. That is my final thing. Thank you.
Thank you. Thank you for your positivity, Dr. Sachdev. We'll end on this very, very positive note spelled out by Dr. Sachdev, that this too shall pass. This is a passing phase. We need to take care of us. Thank you for your very, very insightful comments. I'd really like to thank Dr. Dey. I'd like to thank Rujita Divakar. I'd like to thank Dr. Sachdev, all our very distinguished panelists. And last but not the least, I'd like to thank the very distinguished member of the Niti Aayog, Dr. Paul, for his very, very insightful views and for guiding us during these challenging times. Thank you very much.
Thank you. Thank you very much.
Thank you.
Off kar do.